infarct may simply be defined as an area of necrosis caused by interruption of blood flow to the affected area. Infarcts may be subdivided according to the anatomical area affected and/or the morphology of the infarct. And here are some examples of infarcts subdivided according to their anatomic locations. So the most well-known one, I suppose, is a myocardial infarct, where the myocardium, usually of the left ventricle, becomes infarcted, and these may be further subdivided. For example, a septal infarct, subendocardial infarct, anterior myocardial infarct, etc. Some other examples of anatomic locations of infarcts include pulmonary infarct, cerebral infarct, splenic infarct, mesenteric infarct, and renal infarct. And here is an example of a myocardial infarct, and that is the pale area we are zooming into. Here is an example of a pulmonary infarct caused by a pulmonary embolus that the arrow is pointing to, and this has caused an infarct that is the red area at the bottom of the picture. Here is a mesenteric artery that is occluded by thrombus, and this has caused a mesenteric infarct of the small bowel. Here are some renal infarcts, and these are the pale areas in the cortex of the kidney just beneath the capsule. Another way infarcts may be subdivided is according to the morphology of the infarct. So, for example, hemorrhage into an infarct may be referred to as a hemorrhagic infarct. If an infarct becomes infected, it is referred to as a septic infarct, and these may occur following occlusion of an artery as a result of an embolus caused by infective endocarditis. Lacunar infarcts are a type of cerebral infarct occurring usually in the basal ganglia or the pons, resulting in a small pit or pits just a few millimeters in diameter. Another type of infarct is a watershed infarct. These can occur in the brain, where the blood supply of part of the brain may be from two arteries where the territory supplied overlaps, and if the blood pressure drops, then the territory supplied by each artery will reduce, resulting in an infarct where the two supplies overlapped. Here is an example of a hemorrhagic infarct of the testis, and this is due to torsion, resulting in necrosis of the testis with hemorrhage into the background parenchyma. And here is the histology of hemorrhagic testicular infarction. You can see ghosts of the seminiferous tubules with a background of hemorrhage. This is a septic infarct of the spleen. And finally, this is an example of watershed infarcts involving the cerebellum.